All right. Well, my name is Stanley Dykes, and this is my dad, Curtis. We're going to talk about fall risks today. This is for older adult health and for Dr. A. So, in this discussion is geared specifically to Dad and his situation. So, why is this important? 1 out of 5 falls cause a serious injury, such as broken bone or a head injury. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of a head injury or hip fracture. Each year, 3 million older people are treated in emergency departments for fall injuries. So, Dad's had a few falls this last year. So, we're going to talk about risk. Do you use a cane or a walker?
I use a cane.
Are you sometimes unsteady when you walk?
Yes.
Do you find yourself holding on to furniture
Yes.
when walking? Are you concerned about falling?
I am.
Do you push up with your hands to stand up from a chair?
I do that too.
Do you have trouble stepping onto a curb?
Yes.
Okay. Do you have more than one underlying health condition?
Yes.
Okay. So there is definitely, Dad does have a risk. We're going to talk first about dizziness that Dad has sometimes when he stands, and this is primarily due to postural hypotension, which is just when blood pressure drops upon standing. Less blood is available temporarily to go to your brain, and your muscles create momentary weakness and dizziness, which can create the potential for falling. It's caused by heart issues, poor circulation, dehydration, illness, or sometimes during exercise. And that's pertinent because Dad does exercise. And one of those issues, dehydration, is a double concern because you're older,
Yeah.
and that you don't have the thirst sensation that younger people do, and so that's not always the best way to know if you don't have all the moisture in your body that you need. So, drinking 6 to 8 glasses of liquid a day is one way to help that. Getting out of bed slowly, sitting up on the side of the chair, marching in place for a moment, which those are all things that you do. Making sure you hold on to something when you stand, which you do, and then talking to your doctor about medication. The only thing there that you could change would be the 6 to 8 glasses of water a day, which would potentially help. So these are the basic things to prevent falls. Stay in touch with your healthcare provider and review your medications. Stay hydrated. Again, 6 to 8 glasses of water. Keep your body moving with regular exercise, annual eye exams, and making your home safe. And we're going to talk about making your home safe in just a minute, because most of this you're already doing. Things you already do. You exercise most days. How long do you usually spend exercising?
Like 15 to 20 minutes, I would say, in my regular routine, and then I do some other exercises during the day.
I know you get out and move, going to the store, back and forth to the art room, so you have some activity through the day where you're walking. You're tuned into your health and your body, and you keep up to date with health news, and you take medication that you've been prescribed, and also supplements.
Yeah.
I know those are important to you. You monitor your blood pressure and your pulse, so you know what's going on. You have regular eye and ear appointments. In fact, this last week you had an eye appointment. Dad's 93. He does not wear glasses whenever he drives, or most of the time.
Yeah.
Only when he reads, for the most part. You talk to your health care provider regularly, which we've already mentioned. You have your bed lowered So when you swing around to get out of bed, your feet are on the floor. You have grab bars on the toilets and on the inside and the outside of your shower. And you have a cane that you use regularly. You are not often without your cane. So Dad does a lot of things right. Now, this is Dad's house, and we're going to talk a little bit about some things that he could do to make it a little safer. First off, this is the front door, and there's a step right here, and we're gonna talk about that step. Dad, how do you usually? That's not a big step. It's not high, but how do you usually manage that?
It's a step down, and stepping down is the most problematic for me. So what I do is I've found that if I turn sideways and step off sideways with one foot, I'm a lot more stable. So I step off with my right foot and then step on down. I have my cane there, so I have it on the lower part of the step, so that steadies me.
Mm-hmm. And do you think it would be worth putting a ramp in here or something like that?
I think better than a ramp would be maybe like a post right at the corner edge of the porch there, and I can just put my hand on that, step down, and it stabilize me.
Okay. And what about the step going into the house?
That's not a problem for me because when I go take that step, I'm holding on to the door and maybe the door casing.
Mm-hmm. Okay. So that's one way we could address that issue. We're going to talk about the garage next. And the garage has a couple of areas that are issues along the wall and also some carpeting that's on the floor. So Dad, the main concern here is associated with rugs and things like that can cause you to fall.
Yeah.
Just having things sticking up on the floor. And particularly where these two carpets come together, they create a place that I think needs to be addressed.
Yeah.
We could either cut that carpet down or replace it with a silicone backed throw rug, or what do you think?
Yeah, either one would work. I really think maybe cutting that down and putting some stick 'em underneath it to hold them in place would work real well. The surface they have is good for scrubbing your feet off coming in from the outside. So,
Okay. So let's talk about this other one. The side of the garage here with the clutter. That's been a place where Dad's had an issue. What do you think? Can we get rid of that?
yeah, we can move that.
Okay. And there's a chair sitting here by the car right here. Why is that chair there, Dad?
That is a heavy chair. It doesn't slide or anything like that, and I use it for a handrail so that I put my hand on it and then step down, and it stabilizes me. Stepping down or up.
Yeah. And then here's the back door with the doormat. Similar to the front. Really not an issue because that doormat, I think, stays in place really well. And since you said that step is not an issue because you're holding on to the door,
Yeah.
probably not a big deal there. But here is Dad's shop and art room, and that's where we are right now. And if you'll notice, there's a long walk going down to the shop, and the concerns there are when the weather's wet, any kind of winter weather, those are concerns. And I think then the next is just there's some unevenness in that
Yeah.
walk. And I think the best thing here is to just always have a cane.
Yeah.
And we might even place an extra cane down here in the shop so that if you got down here without a cane, you would you'd be okay.
Yeah.
One of the things that happened recently, we had a very large friendly dog come and wanted to jump, and probably always best to have a cane just to protect yourself as well as just if you needed to,
Yeah.
just to get back and forth. And these are entry rugs into the art room, and they have some backing. There's something down on the ground with both of them, but they're kind of wearing out.
Yeah, they need to be replaced or fastened down.
Yeah, so maybe the silicone, the throw rug with the silicone bottom on it that just will not move, because it is important for you to be able to keep the art room clean. And then this is the art room where we're at right now. There's a lot going on in here. Dad has a lot of, he's been painting in here for many years, and everything has a reason for being here. And however, there are some things that can probably be shifted around to make it safer while he's in here. One of those, there's a throw rug right here that doesn't, it covers the reason it's there is because it covers a phone line. And then another one is there's a little table there on the end of his desk that's kind of sitting out. And then, so I think, and there's some paintings against the wall. So some of the things that particularly, I think this table could be moved, Dad.
We can move it.
It just is one of those things.
Yeah, they're not very stable, those little tables.
Yeah, if you get up and kick it or something like that, it might swarm on you.
Yeah.
And then the throw rug, same thing. Probably we could do something different there to get that line off the floor. And paintings against the wall, probably not the best, because if you go by and kick one and stepping through the painting would be the least of concerns, if you were to get into it and fall.
Yeah.
This is the bathroom at the house. On one side, it's got the rail. On the other side, this is the shop bathroom. It does not. And this probably needs to have rails on it.
Yeah.
Just to help get.
We can do that.
Okay. This is in the shop, we've got an extension cord that just takes off across the floor. It has a good purpose. There needs to be electricity where it's going, but probably.
We can reroute it.
Yeah, probably needs to be rerouted, put up so it's not a potential fall risk. And here is Dad's lawnmower. And if you'll notice, there's a bar right here that comes up. It's got a hole in it. So Dad engineered that, put it on his lawnmower to help him get on and off the lawnmower safely. And it's a good idea.
Yeah.
I think Dad ought to patent it. It works for him really. Dad likes to mow, and that helps him be safe while he's on his mower. And here is a 4-point cane that helps with stability when you're out and about.
Yeah, a single point in certain instances can slip.
Yeah.
And that just pretty well eliminates the slip.
Yeah, and it also,
And it allows it to, if you have to use your hands for something else, it allows the cane to stand up on a.
So you're at Whataburger and you're paying out.
Yeah.
You can just stand it there. All right. The take-home message. Many things you do right, Dad, and I honor that. A few things, that increasing your fluid intake to 6 to 8 glasses a day, not just for postural hypotension, but dehydration in general.
Yeah.
Removing garage clutter and changing the rugs at both doors. Do that. Always have a cane when you go to the art room.
Yeah.
And we'll put an extra cane down here.
Yeah.
Change rugs at the art room door. Remove the runner rug over the telephone line and possibly elevate that line and get it out of the way.
Yeah.
And then remove the clutter such as the little table and the paintings against the wall. And then replace the extension cord on the shop floor.
Yep.
All right.
Sounds good. We can do all those things.
Okay. Well, I appreciate you taking the time to. We've had to do this a few times, so hopefully this time it'll work okay. Dad does a really good job. He's fully functional, drives, and himself around. So, and he's taken care of himself for a long, long time. So, anyway,